Weh, Mat, lama tak jumpa tu. Sihat dia, weh. Dah lighter tak?
Lighter. Weh, kau resak sekarang.
Tak ada lah. Kadang dia.
Do you know nicotine is mostly found in cigarette and it causes addiction?
Do you know what is the withdrawal symptoms and tolerance of nicotine?
How can I overcome nicotine addiction?
Let's find out together.
Now, I will explain about the mechanism of action of the nicotine. As an example, when we consume nicotine by the smoking, it will quickly absorb into our bloodstream. Nicotine in the bloodstream will cross the blood-brain barrier and reach the brain. In the brain, nicotine will bind to the nicotinic acetylcholine receptor located in the neuron and also bind to the mesolimbic dopamine system. The binding of nicotine to this receptor will cause the releasing of the dopamine by nucleus accumbens. The releasing of dopamine will cause the pleasurable sensation to the person. Next, the chronic exposure to the nicotine will increase the nicotinic receptor. This will make brain more sensitive to nicotine. This will develop the tolerance. The dry abstinence will produce the withdrawal symptom and also produce the dependence for nicotine to self-medicate the withdrawal symptom. This will make the addiction to the nicotine. I think that's all for the mechanism of addiction for nicotine. Thank you.
So dependence of nicotine. What is the meaning of the dependence of the nicotine? So nicotine dependence is an addiction to tobacco products caused by the drug nicotine. Of course, not only tobacco product consists nicotine, other drugs consist it too. The dependence of nicotine involves physical and psychological factors that make it difficult to stop using the tobacco. So there are two effects that can be categorized, which is the physical and also psychological. Psychologically, nicotine works on improving your mood, concentration, decreases anger, cope with stress, relaxes your muscles, and reduces your appetite. However, once the nicotine consumption is cut off, some withdrawal symptoms can be seen, such as behavior pattern altered. For example, some people always smoke after meal or when they feel anxious. Other than that, emotional regulation, habitual patterns of nicotine users having a hard time in breaking their consumption as a habit, and they may experience some cue-induced cravings, which they wanted to use a tobacco product when they see people smoking or other around them, which triggers them. As for physical factors, the nicotine user will have the urge to smoke within 30 minutes from waking up, and secondly, ranking the first cigarette of the day as the most important one, and lastly, smoking at the regular intervals throughout the day. Fun fact, there is a test where you can measure on your nicotine dependency, which is known as the Fagerstrom test. And this test will make you answer questions regarding your nicotine consumption and be scored and will be interpreted based on your scores.
So, what is nicotine tolerance? It is result from the adaptation to the nicotine effect. At this, a greater dosage is required to achieve the same magnitude of response. So, how do the nicotine tolerance develop? It is due to repeated exposure to the nicotine. When the nicotine tolerance is developed, the nicotine will mediate a desensitization of receptor and increase the number of binding site of nicotine receptor. So when there is higher dose of nicotine is emitted, it can cause decrease the locomotor activity and body temperature.
So, what are the withdrawal symptoms of nicotine? First is irritability and anger. The brain's reward system is disrupted by nicotine, leading to increased frustration and irritability. Next is anxiety. Nicotine has a calming effect on the brain, so without it, users may feel more anxious. Moving on to difficulty in concentrating. Nicotine can enhance cognitive function, so withdrawal can lead to problems with focus and concentration. And next is increased appetite and weight gain. Nicotine suppresses appetite and increases metabolism, so quitting can lead to an increased appetite and possible weight gain. Moving on to depression, the absence of nicotine can lead to feeling of sadness or depression as the brain adjusts to lack of its stimulating effects. Next is insomnia and sleep disturbances. Nicotine affects sleep patterns and withdrawal can lead to difficulty sleeping or changes in sleep quality. Last but not least is restlessness. Without nicotine, individuals may feel fidgety and unable to relax.
Next, I'm going to talk about nicotine poisoning and also antidote treatment for the nicotine poisoning. So, what is nicotine poisoning? Nicotine poisoning refers to the toxic effect of the nicotine to our body due to overuse or overdose of the nicotine. So, there are a few signs and symptoms that can be seen due to the nicotine poisoning. Firstly, the early signs, which is nausea and vomiting. Nausea and vomiting is a common early symptoms that can be seen due to nicotine that have irritated the stomach lining. Secondly, the increase of the salivation. Increase of salivation is refers to the excessive production of saliva that due to the nicotine toxicity itself. Moving on to the third symptom and sign is the abdominal pain. Abdominal pain refers to the pain in the stomach area that may occur due to the gastrointestinal irritation of the nicotine. So, for the neurological symptom, the patient might come with dizziness and lightheadedness. The symptoms can occur due to the stimulant effect of the nicotine on our central nervous system. To the next symptom, which is increased blood pressure, this is due to the effect of nicotine that stimulate the blood vessel to constrict and lead to vasoconstriction in the peripheral circulation. Constriction of the blood vessel will increase the resistance, hence cause rising of the blood pressure. The last symptom that can be seen due to the nicotine poisoning is the rapid and heavy breathing. Rapid and heavy breathing can be arise from mild shortness of breath to the most severe respiratory distress in extreme cases of poisoning. There are few management and treatment that can be done due to the nicotine poisoning. So, firstly, is reverse nicotine toxicity. Doctor will take into measure about how much our body consume the nicotine, but usually the doctor will add some charcoal to help to wash out the nicotine from our body. Secondly, the treatment is given benzodiazepine to control the seizure in the patient. Next is atropine. Atropine will be used to treat and will cause the slowing of the heart rate. And lastly, the use of ventilator to help deliver oxygen if there's any failure of respiratory. So how we can prevent the nicotine poisoning? Nicotine poisoning can be prevented by firstly keeping all the tobacco products, especially product containing liquid nicotine, out from sight of the children and pets. Secondly, always storing the nicotine product in their original container. And lastly, in order to prevent the nicotine poisoning from occur, we can stop the use of nicotine containing products.